Okay, I have checked my prescriptions orders and I am supposed to give my patient an enema. Before I administer my enema to my patient, I will go ahead and check my documentation and make sure that the patient has no allergies to the active ingredients in the fleet enema. And I will also check my EMR just to make sure that enema has not been prescribed in the prior shift. So now I'm going to go ahead and enter my patient's room. Hello, my name is Alexis. I'm your student nurse for the day. How are you feeling today?
Good.
Good.
A little distended.
Oh no. I'm going to go ahead and hand hygiene. I'll put my gloves on. Are you feeling any abdominal pain?
Yes.
For the next one, if you could just go ahead and advise when y'all do get there. I have the Sub-100 Island Fire Department there at location so that they can go ahead and stage in the parking lot.
Okay, now what I'm going to go ahead and do is I'm going to go ahead and, can I see your wrist please? And can you go ahead and tell me your name?
Elsa Martinez.
And your date of birth?
2/12/92.
Okay, perfect. So I have at this point have checked my patient's vital signs. And now what I'm going to go ahead and do is, you say you're having some abdominal pain. From a scale 0 to 10, what would you go ahead and rate it?
Like a 4.
A 4? Okay, so what I'm going to go ahead and do now is I'm going to go ahead and just lower this a little bit. I'm going to go ahead and just inspect your abdomen area, okay? I do see some distension, so what I'm going to go ahead and do now is I'm going to go ahead and listen for any bowel sounds, okay?
Okay.
Okay, I'm going to check all 4 quadrants at this moment. Okay, her bowel sounds are a little diminished, so I'm going to go ahead and administer this enema. Okay, so what I'm going to go ahead and do is, I did hear for 5 minutes since I really couldn't hear her bowel sounds. So what I'm going to go ahead and do is I'm going to go ahead and assist my patient on the left sits position so I could have proper entrance to the rectal area. Okay, so what I'm going to go ahead and do is I'm going to go ahead, I will obviously have raised my bed by now to my comfort level. I'm going to go ahead and assist you on your left side, please.
Okay.
Okay, perfect. I will cover my patient at the moment just to give her some privacy. I am going to go ahead and place this pad on the bottom. So, okay, I just want to go ahead and okay, perfect. I'm going to go ahead and cover her while I gather my equipment. Okay, this will be the fleet enema. This will have a long little tube. I will go ahead and lubricate the tube at the moment and then just get rid of any excessive air. At this point, I would go ahead and uncover my patient. I would separate the buttocks, and if any lubrication is needed on the anal area, I would go ahead and do that. So at this point, can you go ahead and just breathe in and inhale for me?
Yes.
Okay, I would go ahead and insert it and just move it in circular motion until the whole solution is gone. I will slowly remove this and just cover. I would go ahead and just clean my patient and dispose of this, and I have obviously have disposed of this. I will go ahead and cover my patient at the moment. I will tell my patient as well that if you could just go ahead and try to keep the solution in as much as possible, okay?
Okay.
Now, if it was a bag enema, I will go ahead and just get it out of my equipment, out of the bag. Just go ahead and get this. I will go ahead and place it. I have my Castle soap here, and I would just go ahead and place some lukewarm water as prescribed by physician. And if physician ordered as for the Castle soap, I would go ahead and administer as much as was required. Once I go ahead and do that, I would go ahead and unclamp this, just so I could have the whole solution slowly flow down. At this point, once it's already flowed, I will go ahead and slowly, I will go ahead and clamp it before I insert it. I'll go ahead and clamp it. Oops, okay. I would get rid of this. It's already pre-lubricated. If more lubrication is needed, I will go ahead and do so at this point. I will go ahead and unclamp my patient, and again ask my patient to inhale slowly, and I will close it. I will insert it. I will obviously open the buttocks, and then again, if any lubrication is needed on the anal area, go ahead and do that while also assisting for any hemorrhoids or any bleeding. I will go ahead and insert this, and I will slowly unclamp it so the solution goes in. Once the solution is in, I will go ahead and wait until everything, and then I will slowly remove it and get rid of it. Okay, I will now go ahead and clean my patient and check for any for skin, any breakage of the skin, anything like that. I will go ahead and now clear my patient, and again notify them that if they will be able to, if they could keep this for as long as possible. If my patient was immobile, I will go ahead and assist them with the bedpan. And if my patient was not immobile, I will go ahead and assist them to the restroom if needed. And I would also leave my bedpan at my patient's reach. And if they're immobile, I will go ahead and leave their slippers and their robe in reach, just in case they do need to go to the restroom. I will also leave my call light. If you need anything, I'm gonna go. How are you feeling?
Oh, good.
Okay, I'm gonna go ahead and leave you my call light here. If you need anything at any moment, go ahead and just press, and one of the nurses will come in and assist you. Okay?
Okay.
Okay. So at this point, I would obviously have gotten rid of this. I would go ahead and document. I would document the procedure that was given to my patient. I would document that my patient didn't know what an enema was and why it was being given to them. I would also document if there was stool, the color, the odor, if there was any abnormalities, the quality, and anything like that. And that was my giving an enema to my patient. Thank you.